Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea Brit. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Dr. Veronica Tovar, a Greenville-based dentist who has taken whole body health to an entirely new level. Beyond traditional dental training, Dr. Tovar has trained with some of the top institutes in airway health, myofunctional therapy, oral restrictions, dental sleep medicine, sedation, laser dentistry, you name it, she's probably had some training in it. She's an ambassador with the Breathe Institute and a Breathe Baby affiliate. She's also a Vivos and Toothpillow provider. What really drives her, though, is the belief that the mouth is the gateway to the rest of the body, and the ripple effect she sees when patients finally feel better, breathe better, and realize they didn't have to live feeling the way that they did. As a mom herself, she is especially passionate about helping future generations grow and thrive optimally, and she loves supporting mothers through healthier breastfeeding and airway journeys. Outside of her practice, Veronica's all about family time. She enjoys golfing, working out, reading, and keeping her violin skills alive as well. She and her husband are raising 3 daughters who are currently 7, 9, and 11, along with their 2 pups, Rocky and Raina. All right, you guys, you are going to learn so much from Dr. Tovar. Let's jump in.
Hey everybody, welcome back to the podcast. We are back here with Dr. Veronica Tovar. Welcome back.
Thank you very much.
I am just super excited about our conversations. I don't know if Brittany and I mentioned this, but we've been with Dr. Tovar as patients for, I was just trying to figure this out, a very long time. Probably shortly after you opened your office.
Well, I opened in 2008.
Yeah, it would have been after that, but it was not too long after that. So we know firsthand how compassionate and caring she is as a provider. And everything she said so far is exactly who she is. So our first episode was all about who Dr. Tovar is, her and airway dentistry. That was super interesting. If you haven't listened to that, definitely take a listen to that like that.
Yeah, and I would say in this series, these episodes really build upon each other.
Yeah.
So if you're jumping into this one because the title stuck out to you, I would actually hit pause, go back to the first one because it's going to give you that baseline of understanding before we jump into this topic.
For sure. So in this topic, though, we're going to be talking about how starting early, whether that's you just learning about this stuff and you're 32 years old, or if you have little babies and you just want to learn how to start early with airway dentistry and just learning how airway expansion is just super important. When we say start early, what age are we really talking about? Are we talking about brand new babies? Are we talking about toddlers and preteens and
yeah, for many people, like you guys had mentioned before, is they're listening to this for the first time.
Yeah.
And, that's a challenging question, especially when it comes to families when they have multiple kids and they see me for the first time. And it's like, okay, which one do I start with? Which one is most important? And I never want to pick a child or someone to be more important. You're all important. Yeah. So let's see what we can do all together as a whole. So I will start with simple, basic, let's look at this and start implementing, because some things are easier to implement than starting to get into some other treatments, and depending on the individual. I will tell you, I see newborns in my office. Okay, so starting early as soon as they're born, and honestly, even earlier in utero taking care of that pregnant mommy, especially with what I know now and the connection there is between a mother and the baby. Neurologically, everything that mother goes through during pregnancy impacts how our babies are developing inside. Okay. So I will tell you, when it comes to oral development, that is already happening at week 4 in utero. Okay. And yes, a baby can already start having oral restrictions at week 4. But, do we know those things already? We don't really see that. But what can mom do? So neurologically, physically, taking care of mommy. I always tell my moms, be happy, relieve or lessen your stress. Try to, and of course I love it when daddies are happy that their wives, the moms are pregnant and expecting, especially if it's their first child. They want to do everything. I said, you need to take care of her. I'm not kidding. Happy mommy, happy baby. Healthy mommy, healthy baby. Okay. So yeah, you can even take it to those measures. Of course, I don't see a lot of people when they're pregnant, but a lot of times when I am seeing the infants in my office is because there's issues, there's problems.
Right. There's a problem and now they're coming to you.
And now they're coming to me. So, and of course we only want to address any oral restrictions if there is a functional problem. Okay. So I know for many people, especially when we're looking at our babies and we're looking at tethered oral tissues, that could be under the tongue, that could be in the cheeks, or that could be in the upper lip. Okay. And I will tell you, all of these structures are normal. It's just if they're restrictive. And part of the conversation that we get into is working with the right people in the process. So our IBCLCs, our physical therapists, or our chiropractors, or our body workers who are cognizant of those connections that can make something be restrictive and not be physically restrictive. So I talk a lot to my moms about, I'm going to look, I'm going to feel, and I'm going to listen to what your problems are at hand, but understand it's just not what I do that is going to help you in this process. Okay. So, and I'll have my moms and my dads. I say kudos. I give them a lot of applause. I said, thank you for being here for your baby and being here for your wife. And I'll tell you, I get a lot of dads that are like right in there and they're like, yes, I'm gonna do this. And I love it. I commend them. I think that's so important, especially for the moms that are going through this. First-time moms who are confused, scared, and just want the best for their babies.
Hormonal, breastfeeding, whatever.
Breastfeeding. And if mama's apprehensive, mommy's anxious, so is baby.
Yeah.
So we need to help our mommies there. Okay.
So if you have a newborn and they go to you, are you able to diagnose tongue ties?
Yeah.
Okay. So see, I feel like a lot of times, and you're right, a lot of times moms with newborns will just, they'll try to breastfeed and then they're frustrated. And then who do I see? Maybe they see an IBCLC. That's great. Maybe if, they can come and see you, you can get them the right information and then the connections to the right people.
Correct.
Right?
And you actually do revisions in your office now too.
Yes.
Right?
I do.
So tell us about what types of revisions you offer, but then also how do you determine if a baby truly needs one or not?
Well, and I already said it already, is there has to be a functional restriction. Okay. So I say these structures are normal anatomical structures. But if they're not allowing, we'll say, full mobility of the tongue, so as we understand the anatomy of the full body of the tongue to be able to express the milk from mama and actually get fed and not suck in air, not become colicky because all they are full of is air, gassy, spitting up, clicking. We're not getting a good seal. And then we also look at lips and cheeks. So again, restriction, which again, I feel for the restriction. You just can't see it, although sometimes we can see blanching of the tissue to know that there's a restriction. But again, I have my moms and my dads feel for them like, oh gosh, yeah. Now I have been introducing some photobiomodulation in my office as well with some red light laser treatments where we can actually warm those fascial tissues within the oral space, that we have seen some decrease in some of those restrictions. So I am trying everything possible to not put a baby through a procedure. Okay.
Yeah.
But when there is that physical restriction, there is nothing more to do than to physically release it. And I use a CO2 laser for that.
Yeah.
But, you know, and I may be conservative at times. I never want to be aggressive.
Right.
But understanding with the babies or the moms that I speak to is that I can still feel tension after release. That's outside of me. That's body work. That's craniofacial, craniosacral, addressing that system to assure that we relieve this the remainder of this tension and tightness to help baby along their pathway.
What about kiddos that are maybe more toddler age?
Exactly. So, so when I start seeing kids, I mean, I don't see them all, nor do they all present with problems. And I'll tell you, that was with my own kids. I did not have, or at least I didn't think I had issues breastfeeding or nursing my babies because they seemed to do well.
Right.
I mean, the cluster feeding, I thought that was just the thing.
Is it not?
Not just a thing, no.
Really?
Because she was filling up, and she was filling up with air, so she felt like it was,
Full,
and not that it couldn't be anything else, of course, but in her case, yes, my daughter's tongue-tied. And she was cluster feeding because she would fill up with air, she would spit up, and then she would fall asleep because she was tired of working, and then she would be hungry again, and I was spending hours just feeding my baby.
Oh my goodness.
So you were a dentist already at this time.
I was already a dentist and did not know this.
Wow.
Yes.
Look how far you've come.
Just the things that we all wish we knew back then.
So, you know, depending on the toddler. So, you know, we will say 2 to 3 years, you know, if we see an oral restriction, really depending how that child is. There are steps and measures that need to take place after a revision is done to assure there isn't reattachment. So whether it's done at that time or we wait, it's really, again, patient specific. How do the parents feel? I never ever want my parents to feel like they have to do something, okay? Because if a kiddo's not ready, or if they feel like they can't do the wound care or the body work or everything else, then let's try to see how we can manage them in other ways. So I will tell you, I see infants, if I didn't see them as babies, I encourage seeing them already at 6 months old.
Okay. I was going to ask you, because I feel like, and this was back in the day, if you will, because, you know, my kids are older now, but when they were babies, it was kind of like, oh, you don't need to see a dentist until like a year old or whatever. I never would have thought of bringing my kids to a dentist for for tongue ties or breastfeeding ever.
Yeah. So at 6 months old, what we're already talking about, there may not be teeth present at 6 months old. And for some, there might be. So, we'll talk about the oral hygiene aspect, starting to introduce a toothbrush. We may not be flossing already at this time, but we talk about breathing. Mm-hmm. How's your baby breathing? How's your baby sleeping?
Planting seeds, right?
Planting seeds, looking at growth and development, even though we can't quite see at this time, but we can by when the full set of teeth are in. There's no space. I always say by 2 years old, when we have all our teeth in place, we should have a dime size of space between all teeth, front and back. If we don't have that minimal space, they're underdeveloped. Oh, they're at risk.
Yeah.
They're at risk for mouth breathing, crowding, not enough room and space for their airway space.
Yeah. So
I start early. And then that's when I introduce other tools. If we're having trouble breathing, nasal hygiene. If, some would have the issue of pacifiers or thumb sucking, I introduce Myo Munchee.
Okay.
So things that they can introduce on their own. Now, some things, for example, the Myo Munchee baby can only be purchased through a provider because we want our parents to understand that it's not just giving you something and this is going to be the magic.
Okay. Yeah, there's education.
There is some work in progress that needs to take place, plus the other specialists that need to be also looked at for results to be achieved.
Yeah.
Okay, I did want to talk about this a little bit because I had a thumb sucker and then a 2-finger sucker. And I know when you're pregnant with your first child, there's a lot of people that are like, oh, I've heard that thumb sucking or having a nook can be really hard transition later in life, or it can create different challenges in the mouth. I'm just not going to let them start that from the beginning. And then you have your baby and they're colicky, maybe a reason to come see you, but you're just like, I just need peace. Here's a nook. And then it's just,
and you're like, they're quiet.
Yeah. So I did want to ask you about that is thumb sucking, nooks. You mentioned Myo Munchee. What is that? Is that almost a replacement option for those things? And then if you have a kiddo that is currently thumb sucking or has a nook, what is the age they should for sure be done? Or is it like as soon as possible? Just walk us through a little bit about this topic.
Yeah. And, the pacifiers, and through a lot of the seminars and trainings that I've been through, a lot of times they will say the pacifier isn't to pacify the baby. It's to pacify the parents.
Right?
Or anybody around them.
Yeah.
We would love to say that, we want to eliminate. I understand that for some it's a need. This is what we need it for. And we understand it. I understand it. It's taking the place of the tongue. The tongue is the body's natural soother.
Yeah.
The tongue getting to the roof of the mouth is stimulating that vagus nerve for that soothing relaxation, release of the endorphins of the body, the oxytocin, dopamine, and anything that helps us relax and soothe. If the tongue doesn't have the room or space or strength or tone, then it's finding other things. So I'd love to say by 6 months to start weaning that baby away from that passy. And I'll tell you, a lot of babies, and my babies were them right there. I was not happy with the nurse, when I had her, just wanted to put a pacifier, and she just went, just spit that thing out. Good for you, baby.
Look at that tongue
girl.
work.
That a girl. But she was still tied. She is still tied.
That is interesting, though, because the passy is pressing up against that vagus nerve. That's what helps pacify them.
And release those relaxing hormones.
So, but if their tongue's not working to do that themselves, it's not practicing. There you go.
So that is what soothes the baby, is the stimulation of the vagus nerve. And that's why they want their thumb in their mouth, especially thumbs, because then they curve up and they're hitting that top of the roof of the mouth in the front, right where the tongue should be resting.
Yep.
Okay, you guys understanding all this?
I knew that, but now it just kind of connected there. Yep.
So then what is the Myo Munchee?
So what the Myo Munchee is a oral device that is ideally already shaped in a position that already a baby maxilla and a baby mandible should be shaped in, and appropriate relationship per se, although we know the baby's mandible isn't going to catch up to the development of the maxilla until about 2 years of age. So there was always going to be a little bit of a setback of that, but it's a device that baby can use to put in the mouth and, as it states, munch.
Okay.
And by munching it, it's already helping form that palate, guide growth and development. At the same time, it's growing or strengthening the muscles of mastication, the muscles that develop the face. We talk about strength and tone. Ideally, what did they have 100 years ago when we didn't have these tools and devices? Well, they had hard foods for us to eat.
I was going to say carrots, things like that.
They had raw
they would
foods,
eat those things,
but right now, and I will tell you, I was even one of them, is I'm afraid my kid's going to choke. I don't want to give them something hard. I don't want to put them to work, and it's okay. Mm-hmm. Big pieces of things that they can gnaw at is good work.
It's baby-led weaning, right?
Baby-led weaning,
yeah, we should
absolutely.
Put in information in the show notes about that.
Mm-hmm. As we help strengthen and tone those muscles, then we have we create that defense mechanism to not allow that to go to the back of our throat and causing us to choke. Mm-hmm. As we're chewing things, our own saliva works to break down the food as well, soften it, and then give us the ability to swallow. There's too many foods in pouches these days, or too many melt-aways that we're missing it.
Well, you're not using our jaws.
You're not using your muscles to make something melt away, are you?
So are you saying that historically people that had harder food to chew and would have to do that in order to survive, that's just what they did, they typically didn't have the crowding of teeth and like the narrow palates that we have?
No, ma'am. And there's been a lot of work done to pull these skulls of 100 years ago and to show jaws fully grown with 32 teeth.
Yeah.
Including their wisdom teeth. And we should have that room and space.
Yeah. I know that we'll mention this book later, but I think we should mention it now. Breathe by James Nestor. I know he speaks about this in there, and I love that book. Like I would read it again because it's very well written, and it's not just like education. It's literally like stories and just understanding deep into it. So
what's nice is he's I would say he's a New York journalist, and what's nice about him is he was a skeptic.
Yeah,
I was like, what's the big deal about this stuff? Is this really important, this nasal breathing? And he did his own research. Where he plugged up his nostrils and did mouth breathing for 2 weeks, was it?
Yeah, it was something like that.
Forget what it was. And then he did
like torture.
Strictly,
yeah.
And then he's like, yeah, there's truth to this stuff, guys.
Let's continue. Yeah. Let's continue talking about the middle-aged kids. We've heard a lot about different types of treatments for oral expansion. So if you have a kiddo coming into your office, I don't know, let's say that they're 4, 5, 6, 7, 8, 9, 10, somewhere in there, and you can tell that they have too narrow of a palate, they'd really benefit from expansion. There's traditional expanders. I don't really know all that much about those, so I'd love for you to kind of walk us through how those actually work. But then there's also these new programs like Vivos and Toothpillow and Myobrace. Can you walk us through the different options for expansion?
Absolutely. It comes down to how much deficiency is there. And I always ask my parents about compliance. How do you feel your kiddo would do? Certainly, the more narrow they are, they would need more or less the expansion. The expansion I do in my office, I expand upper and lower arches. What we know is the upper is what's foundationally underdeveloped, and the lower, unfortunately, is trapped, and teeth are retroclined or tipped inward. So a lot of people ask, well, why do you do the lower as well? Well, that's how I was trained.
Yeah, well,
it kind of makes sense.
But it makes sense that if you are, expanding the foundation of the upper, the lower teeth need to meet with those teeth and not force them back. Now, have there been situations that I have seen where upper expansion has been done only, and there can be situations, yes, where upper expansion is done only, maybe because those teeth are already in crossbite, so that, the jaw itself said, no, I'm not going to come in a pathway that you're going to trap me. I'm going to come in a correct pathway. So it, again, case specific, but more likely than not, and those are your statistics that could change next year, is upper and lower expansion. They're fixed. They stay in the mouth. There's activations every day until we introduce the lower, and then we do that 3 times on the upper and then lessen it on the lower because the mandible is denser bone. So we do it slower. I know there's a lot of talks about rapid palatal expansion, and for me, I like taking my time, especially if I want to make things last and not be overly aggressive with forces on the teeth.
So are these expanders actually put into the mouth in like the palate area, top and bottom, and then that's where so they're not braces.
They're not braces.
On the inside of the teeth, helping to push outward?
The design of the expanders that I use have bands that go around 1 or 2 teeth, whether they be baby and adult molar, depending on what age range they're at. So even as early as 6, if they're very narrow, we can even place them on just baby teeth as well. I try to give my younger kiddos a benefit of the doubt and kind of lead them in another direction to say, hey, see if we can still help you grow, because a 5-6-year-old has more time to grow than a 10-11-year-old, right? Yeah. And I know they can talk about sutures being fused and you're limited to how much you can do, but I think we know a little bit more about how much we can actually do with our mouths. Hello, I expanded myself to 4 millimeters, okay?
Yeah, so adults, yep.
We can do it. It just, you can't do it fast. With that being said, depending on the child, compliance, I always introduce my families to Myo Munchee. So Myo Munchee isn't just for babies. They have Myo Munchees for the older kiddos, the teens, and even for adults. And I say, if you don't know if your child is going to be able to tolerate something in their mouth, try this first. It's an inexpensive route to implement something. Their recommendation is to utilize it 5 minutes in the morning, 5 minutes at night. And you'd be surprised what you can do with just that little bit of focus and attention in the mouth to strengthen, to tone, to encourage the nasal breathing, and move along the pathway to say, hey, I can tolerate this device. Let's see if they now can tolerate something overnight. And that's where our Toothpillow or our Vivos guides come into place. Myobrace is very similar, It's just Nike or Adidas.
Right. And so the in-mouth expansion is different than the Vivos or the Myobrace and things like that.
The expansion that is fixed in the mouth, there are activations that are going on daily initially, and then 3 times a week. So you're going to get more room and space immediately.
Yeah.
It works wonderfully. It's not pressed against the palate because we need to give that foundation room to grow, because then that palate will drop.
Yeah.
Okay. So not only are we growing the foundation that the teeth are going to be in, but we're also growing the nasal passages because the roof of the mouth is the base of the nose. And if we're high and vaulted, we impinge or take away some of that airway space. As we expand, we're now increasing the surface area of the nasal passages of any individual. But it's definitive, but it's also something fixed in the mouth.
Right.
Something that they have to, I'm not going to tell you it's painful. They used to be, because they would go around the gums, but they still have to be really diligent with home care, hygiene, cleaning around it, and making sure that that we don't get the inflammation or the food entrapment that we can, because we can't access areas.
Right. And the Vivos is where you actually have to put it in. You have to chew down on it.
It's
So it's a different, it's a mouth guard, but it's just a different compliance piece.
Correct.
So what are you going to be able to do? What are you willing to do? Right.
Exactly. So putting in the mouth, sleeping overnight, just by sleeping with it overnight, we're already promoting that nasal breathing. We advise active wear. The older the kiddo, the more active wear we advise, because that active wear is their muscles working on that growth and development, and it can be achieved. I've seen it happen not only as a Toothpillow provider, but in my office as well.
Okay. Yeah.
Let's talk about adults as well, because somebody could be hearing about this for the first time, and there are probably plenty of adults out there that are mouth breathing or snoring or even have tongue ties.
Oh, yeah.
So tell us, what would the journey look like for an adult?
So right now, depending, again, how deficient are they? I will tell you, I talk to all my patients about this, and just merely making the introduction of, okay, these are things we need to do. We need to get you breathing through your nose, and we need to strengthen tone muscles. Now, some may go down the myofunctional therapy aspect, which no matter what, adults need the myofunctional therapy. No matter the age, even kiddos have already learned how to compensate to use their muscles, the tongue specifically, if it is tethered or restricted. Adults are even more compensating. So we need to train and tone and assure that we have room and space. If we release a tongue, specifically a tongue, we can talk about lips and cheeks, that's not as much of an impact. But if we release a tongue without room and space or strengthening and toning, we put them at risk for airway problems, OSA, upper airway resistance. Because where does the tongue go when it's free then? Down and back. If they don't have the room and space, strength and tone. Right now, that tight or tethered tongue keeps it forward for them as much as it can, of course, right? Because it also could be what's blocking their airway space.
Oh, super interesting.
So we definitely want to have the body work. We want to create the room and space and perform the strengthening and toning. And we have patients that do it, and they're loving their results.
Wow. That's just it gives people so much hope that, like we talked about, this stuff can be reversed. Like for adults even, it's not too late. You oftentimes think as adults, oh, our bones are formed, we're solid, this is just what you get, right? And what you're saying is that's not the truth. There's a lot that
I can tell you as an adult who had braces, your teeth do move. They do still move.
Yes.
And you do have to do it slowly too, unfortunately. But yes, it makes sense. So
absolutely. And the aspect of, how soon or how early, I think as soon as you're able to. Okay. Every day you have trouble sleeping or your mouth breathing or have poor quality of sleep, your brain cells are not optimal. They're degenerating. So for cognitive health, and I will say the correlation to Alzheimer's, dementia, other diseases, but that specifically, hits home with my mom. I wish I knew then what I knew now to be able to help my own mother who is suffering from Alzheimer's dementia. And there is research to show that it is because of mouth breathing in your sleep that causes that beta amylase to be built up in the amygdala or hippocampus of the brain, which is our memory center.
Wow. Well, if you're listening to this episode and you're learning about this for the first time, your next step is to go see an airway dentist, whether that's Dr. Tovar or somebody else who knows exactly what they're doing as far as airway dentistry, and get evaluated and just understand, where you're coming from and pay attention to your mouth too. Pay attention if you're mouth breathing, if you have that forward head position, if you're snoring, or if your husband or wife is. This is important stuff.
Mm-hmm. And share it with your family and friends, because
and tell them.
I mean, if you were to just throw a ballpark number out there, what percentage of your patients that come in would you say could use some expansion or some sort of work in this area?
Oh gosh. Yeah, that's a pretty high number. 80 to 85%.
Yeah. But most of them probably don't even have any idea.
Or they're like, they just come and get their teeth cleaned and you're like,
Yeah. When you have that concept that I'm fine, I'm okay. I think that's a very vague term. Like what exactly are defining as fine? And I see that we're on medications for hypertension or diabetes, adult onset. I'm like, why did this just all of a sudden start happening? It's not just, I won't say that correcting mouth breathing to nasal breathing is going to fix all your problems, but you will be surprised how many of your problems do get alleviated.
Yeah. And you don't know what you don't know, right?
You do not. I didn't know what I didn't know. But I will tell you, for patients, they don't have to see me for their general dental care. I can specifically focus on their airway health. And they can still see their providers to do their general dentistry, because there's only one of me right here, right now.
Yeah, we should talk about that.
But, if there are any other providers out there, I would encourage to get on the bandwagon so we can help our patients even more.
Yeah, absolutely.
Young and old.
Love it.
And I know you're really great at recommending resources so families can continue this education. They can learn on their own. We had talked about the book Breathe. You also have the book in your office called Tongue Tied.
Correct, by Dr. Richard Baxter.
Yep.
It's a great book to understand the why, addressing it early on, and really understand what happens if you don't treat it and don't address it. And I can tell you, I see a lot of adults with different ailments and different conditions and different problems, but that's what our DNA does for us. We compensate in different ways. I also like to encourage Sleep Interrupted by Dr. Stephen Park. It's a great book. And I know there's some writings out there by Dr. Susan Bonnick, really talking about children and growth and development and oral ties and the impacts with all the research that she has done, specifically behaviorally and cognitively, like learning, the impacts that has had, are all great resources.
We will link to all of those in the show notes. And then if you think of any more off the mic, we're going to add those in the show notes too. So
yeah, for sure.
Make sure you guys go down and check that out. If someone would like to get in contact with you, come make an appointment or something else, how would they get in contact with you?
I would say right now the website is www.vtovar.com. That will be changing as my website is in the progress of being updated, hopefully sooner rather than later. But we'll have some more resources and information and ways to request an appointment online.
Perfect. And you can also go to her Motherhood Alliance profile. That's a great way to get in contact with her as well. So thank you for sharing so much in this episode. We have 2 more left, and we're super excited about these. You kind of mentioned that whole piece of how the top of the mouth is the floor of the nose. We're going to be talking more about nose breathing, why it's so important, mouth breathing, why it's maybe not the best thing for you in the next episode. We're going to get a little sciencey, so I'm excited for this one. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.